morning, everyone. I'm Hartford HealthCare's Tina Verona. Thank you all for joining us on this Friday morning. We appreciate it. We do have our panel of guests available to you today. We, of course, have Dr. Ajay Kumar, our Chief Clinical Officer here at Hartford HealthCare. Alongside me, I'm going in order of my screen, we have Keith Grant, APRN, Senior System Director of Infection Prevention here at Hartford HealthCare. Next to him, Dr. Ulysses Wu, our Chief Epidemiologist here at Hartford HealthCare. And we're really happy to have with us Sarah Lewis, our VP of Health Equity for Hartford HealthCare. This is the first time coming up on Monday, Hartford HealthCare has chosen to recognize Martin Luther King Day. This is a very important day of observance. Hartford HealthCare has really done a lot of work surrounding health equity, diversity, and inclusion. And we have Sarah Lewis today to talk about all of those things that we have done and continue to do. But first, I'm going to have Ajay Kumar kick it off with the update on the data across Hartford HealthCare. Thank you all for joining us.
Thank you, Tina. And I appreciate everybody getting together again. And I'm really excited to have Sarah Lewis today, and obviously Keith Grant and Ulysses Wu as well. We've got a lot of activities going on across the system, across our communities at this time, and which really shows the commitment the Hartford HealthCare has as, to improve general well-being and care across the Connecticut. But before I go into that, I'd like to talk about the numbers, at least the number of patients actually we have in Hartford HealthCare. And I said that before, the number of patients in Hartford HealthCare could be misleading, as many of those individuals are actually coming in for other reasons to the hospital. So I want all of us to take these numbers in context. The one positive sign is that the number of patients has stabilized to a certain extent. At least in the last 2-3 days, we are seeing a similar number in the hospital. We have 526 patients across the system today, which includes in our behavioral health setting as well. Bacchus Hospital has 50 patients. Charlotte Hungerford has 39 patients. Hartford Hospital has 233 patients today. Mid-State Medical Center has 39 patients. Natchog Hospital has 7 patients. St. Vincent Medical Center has 71 patients. Hospital Center Connecticut has 69 patients. Wyndham Hospital has 18 patients.
Stink out of your boots. That's worth 69.
We also have 62 of those patients in critical care at the moment, and 49 of them are requiring ventilation support. We continue to see a significant number of patients who are coming in for other reasons, such as individuals that have been in behavioral health setting. They're coming for mental health issues, but they happen to have COVID. So incidental COVID is something we need to keep an eye on at the moment. As I mentioned yesterday, it does not reduce the resource implication or the staffing hard work required to manage those patients, and obviously some of the outcomes on the patients as well. Last evening, I had a pleasure of meeting several clinical leaders in one of our health acute facility, and I learned majority of the individuals who are unvaccinated, who does not have a boosters, are having a significant difficulty in recovery at the moment, and many of them are unfortunately not able to make it. Again, it's a reminder for all of us to continue to focus on vaccination and boosters that do really help in preventing illness and death. And we'll talk more about it as we go further. But before we go further, before I give it back to Tina Verona, I just want to highlight a couple of things. One, work we have done across the system in this phase of pandemic in terms of equity and health disparity. And the work Sarah's leading in transforming Hartford HealthCare's thinking around the health equity is something to celebrate, and something to celebrate when we have our first ever MLK Day celebration coming up for our system, which Sarah will talk a little bit more about it. And in this conversation, I'd like Keith Grant and Sarah Lewis to talk about activities we're doing. And Keith, maybe you can highlight some of the work you've been involved with Hispanic councils and other areas of underserved area you've been working on. So I'll give it back to Tina as we continue the conversation. Thank you.
Thank you, Dr. Kumar. Before we get to that, I want to have Dr. Wu talk a little bit about what we are seeing in terms of, I know we got a lot of questions on yesterday's briefing about the peak and your thoughts on that. Where do we stand? Are we still on track for next week? I believe you said sometime.
Yeah, absolutely. So Tracy, get ready. Mike, get ready. Alex, you too. I got some numbers. Get your pens and paper out. We talked about the roller coaster. So I'm going to give you some numbers and where I suspect the peak has already actually happened. Now, there's a big if. It is if these numbers continue to hold. And the areas where I think they may not hold right now is the ICU and ventilators. But I pulled all the data together for you. So our percent positivity date was the 7th. Our peak for the 7-day rolling case average for cases was the 5th. The hospitalization 7-day rolling average peak was the 11th. And that was the same for our 7-day rolling death average. This is for the state, not for Hartford HealthCare. The peak for hospitalizations was January 11th. That is in the state. The peak for ICUs is the 12th. That is in the state again. And in the state for vents, the peak was the 9th. Finally, the highest in terms of COVID admissions for peak was January 5th. Looking at all those numbers, if they hold true and they all stay down, we are now on the downside of the roller coaster at this point.
All right, sure, more questions to come on that. Thank you, Dr. Wu, for that synopsis. I do want to turn it over to Sarah Lewis now. We're really happy to have you, Sarah. I know you and your team have done a lot of work around diversity, health equity, and inclusion. So I really want to give you a chance to speak about all that we've done. Obviously, MLK Day on Monday, where we will be observing that, and then what yet to come as well. So thank you, Sarah.
Thank you, Tina. And yes, it's really exciting that we're celebrating Martin Luther King Day as a health center, as a health system this coming Monday. Observances, national holidays are moments for us to reflect on our values and the things that we hold most dear. And so in the ongoing struggle for human rights and civil rights in this country, it's only appropriate that we give our colleagues the opportunity to stop and reflect about that ongoing quest for justice, both within our system and within our community. And we have a lot to celebrate in terms of what we've done already. The ways that we have pivoted multiple times to respond to what we were seeing in the data around inequities in COVID and the way that it was affecting communities of color across the state, low-income communities, communities of essential workers, and reaching out with my colleagues here that are in this briefing with us today to ask our communities, how can we show up for you? How can we make testing more accessible? How can we make vaccines more accessible? Working with the state to make sure that the communities that were on the social vulnerability index were prioritized when it came to access to vaccines, and continuing that outreach now that we're looking at the efficacy of boosters, and saying it's time to up your immunity so that we can, for parents of young kids who are not eligible for vaccines, build that moat of immunity around them, and for everyone who wants to make sure that we're not spreading disease to people who are not able to get vaccinated yet, protecting others through the act of getting boosted. Within our system, we're so proud of the ways that we have stood up opportunities for our colleagues to really be a part of the conversation and for their identities to show up at work and to see and feel the way that belonging manifests itself at Hartford HealthCare. So our system-wide Diversity, Equity, Inclusion, and Belonging Council, we have those councils stood up and in the process of being stood up in regions across the system, within our behavioral health network, colleague resource groups where colleagues of like identities can talk about their experiences, get the mentorship that they need, the advancement that they need within the system so that they truly can bring their best work and their best selves here every day. And we are continuing the work that we did in response immediately to the murder of George Floyd, and making it a part of how we can talk about the injustices that exist in the world and the ways that how we show up and center the needs of our patients every day help us to actually move forward in that work forward in that march towards justice. So much that we're proud of.
Thank you, Sarah, for your great work and the team's great work on that. And really some of the results of that great work we have seen with our neighborhood health program that we have that was launched during COVID. And it's really incredible. They're mobile caravans that literally go out into the communities and are really making a difference. They're providing boosters, much critical healthcare that we know. Some of those disparities that Sarah and her team have really worked on. And Keith, if you can talk a little bit about, you were at the Hispanic Health Council just the other day with the neighborhood health teams, and you really, that communication that we have with the neighborhood health teams and bringing you in, explain a little bit about what you did and how you were helping those folks out there today. It's really critical and important work that's being done, and it's really, really needed. So if you could talk a little bit about what you did.
Absolutely, Tina. Thank you. And Sarah, thank you for your leadership, and Dr. Kumar for empowering us to continue to do the right thing within the community. If you look at data, and this data is in existence before COVID-19, and we can see the impact that COVID-19 has had on specific communities, disproportionate impact. And if you look current data, if you look at zip codes within West Hartford and Northeast Hartford, the life expectancy, the difference is about 15 years. It's pretty significant. And Hartford HealthCare as an institution have identified opportunities within the state that we can make a difference. And it's not the conventional, might not be the conventional process of healthcare. Might not be the brick and mortar that needs to be set up in areas, but what it might be is a redefined, more specific way of communicating with our community. And neighborhood health, I think, is an excellent first step forward. I can tell you the experiences that this team has had with the community is exceptional. There is a true acceptance of the need for the service within the community. I spoke about this yesterday, Tina. We had a number of cases, number of patients. We have continued to have a number of patients that benefit from this program. A few days ago when I stopped by, there was a young man that was there, and from that process, we gathered some experiences that we really need to take back and look at. And one of the things that Ulysses and I were consulted on this case, and we were initially told that this young man was homeless with a very serious condition that needs to be addressed, but hasn't reached out to the health system because, he was homeless and he wasn't sure how to make access. And after we started questioning, we found out he wasn't homeless. He was undocumented, but he was scared for himself and his family. So he'd rather try to kind of bear it out as much as possible versus coming forward and exposing himself and his family, his address. And that's something we have to figure out how to address as quickly as possible. And through the neighborhood health processes, we're able to get him a relevant consult very, very quickly. In fact, as quick as possible. And, I'm happy to say that he was properly diagnosed and treatment has started for this young man. But these are opportunities and data points that we would have not have captured, right? And the other thing that I will say, and Sarah and her team has done a wonderful job at this, is appreciating that there's things that we absolutely don't know, that we're not going to know. The people who know these things much better than we do is people who are embedded within this community. So working very closely with community leaders, working very closely with institutions such as the Hispanic Health Council, working with religious leaders, and appreciating it's not just hesitancy, there's an opportunity for education. So Tina, you and your team, I constantly compliment you guys, but the message that has brought forward from Hartford HealthCare about this has done wonders for the community in educating individuals and moving forward. Last thing I will say, as Ulysses talk about the numbers going down, we continue to needing to figure out how to address, diabetes is still higher in certain populations, cardiovascular disease, hypertension, early childhood mortality. These are things or pandemics that exist within communities that we need to address, and Hartford HealthCare will continue to work on this in collaboration with the community.
It's such important work and critically needed. And I think we go back to, we talk about access, and it's bringing that access to the community. And Sarah, if you could talk maybe a little bit more about this, bringing that access to the community where the care is needed the most, because, and Keith, as you mentioned so eloquently, the person that you helped the other day would never have come to the hospital, or would have come to the hospital when it's a critical need. So by meeting them where they are, and it's the Hispanic Council, it's having these critical partnerships with the churches where they trust and they go to. So it's by bringing those healthcare clinical experts there where they are, makes a difference. So if you can talk maybe, Sarah, a little bit more about the trust factor and meeting them
Yes.
where they are because that's where they trust to go.
Yeah, that is the key term here is trust and trustworthiness. And the way that you build trust is by showing up and continuing to show up. And I think that's what's so remarkable about these neighborhood health teams is that they're so dedicated to building relationships visit by visit, and not just being there for one day and never coming back, but they've been able to get to form relationships with people who have some medical mistrust rooted in previous experiences that can range the gamut, but they can overcome that by meeting somebody who truly cares about them and who just wants to hear their story. Sometimes it's a matter of sitting down and listening to someone's story so that then you can treat them. And they give that time. They will spend hours with a person who wants to tell them their story in order to get them the care that they need. And those experiences are the ones that we can build upon in order to, over time, truly help that person be healthy in the way that they want for themselves, for their family, for their communities, and it affects the rest of their lives. It affects their stability, their ability to hold a job. It affects their ability to, be a vibrant member of their church, whatever it is that means the most to them. And so that's how we choose where we go. We go to those partners in the community who are that safe space, who do provide that sort of, that shelter in the storm, and we meet them there and we say, because this is a safe space for you, can we help you today? And if they say yes, that's where the door opens for us to continue showing up and meeting them there for that trustworthy access. And as Keith mentioned, there are so many stories that we could tell. I mean, when we continue to go back to Open Hearth, the men's shelter for people experiencing homelessness, there are so many issues that can get resolved. People have medical issues that need resolving around medication, and getting back into the medication that somebody needs in order to, again, find the job that they want, reconnect with their families, find a permanent home. These things make a huge difference. These are the foundational aspects of health and well-being that we can address through these programs.
Sarah, thank you for that. We're going to open it up at this time to reporter questions, and I see a lot of them coming in the chat. So we're going to get to them in the order that they are received. Our first one is from Tracy from the Waterbury Republican American. As of Wednesday, of the over 2 million Connecticut residents who are fully vaccinated, 4.5%, a little more than that, have contracted COVID-19, according to state data. Of that group, 355 fully vaccinated people have died of the virus. Could you talk about the number of deaths among fully vaccinated folks?
Keith, you want to take this on?
Yeah, absolutely. Yeah, so one of the things we talked about this a lot in our understanding of the actual purpose of the vaccine. So to keep in mind, Connecticut was one of the first states working, Hartford HealthCare being a significant partner in that, is delivering vaccines in the tier 1 group, which are individuals over 65. Within that group, we've seen within the group of individuals who have true breakthrough cases, a number of individuals over 65 with existing comorbidities. At one point, reviewing the data, the average age for individuals going through breakthrough and critically going through breakthrough are over 80, 85, right? A number of people that when you look at the mortality data, there's a significant amount of complication and complexity, health complexities, that are also existing within this population. So again, it is very important for us to take this data in context. Additionally, one of the things that we're now looking at very, very closely is COVID-19 as a diagnosis in the hospital versus COVID-19 as an indicator or something that we picked up just from surveillance testing. So Ulysses and I use this thing where it is clinical definition and surveillance definition. So a number of these individuals we strongly believe there's a number of individuals who not only have COVID-19 are not only in critical care, individuals who might have died from COVID-19 that might not have died as a result of COVID-19, but have other complexity to include comorbidities that come with aging. So again, very interesting data, but it's still, we have to focus on the fact that if you look at our mortality rates that exist within our community, if you look at our hospitalizations, the vast majority of individuals that are in hospitals in critical care that are vented. And when I say vast majority at this point, 80+% are individuals that are unvaccinated or not boosted currently.
Our next question comes from Jordan Fenster from Hearst Connecticut Media. Has the average age of COVID patients decreased or changed since the start of the pandemic? Are younger people getting sicker? If so, does this signify a shift in the disease dynamic, or is it more about vaccination rates in younger populations? He has another question, but we'll answer that one first.
Ulysses can answer
Dr.
that.
Wu?
Yeah, absolutely. So yeah, the average age has gone down, but I don't want this to come across as it's gone from the average age was 80 to 20. It's not like that. I mean, the average age has drifted down. A lot of this was because a lot of the boosters and the vaccinations were obviously offered to, were distributed somewhat on an age base in the beginning. And also the younger generation also is not as prone to get vaccinations as well, but it hasn't been that drastic of a change. Those who, as Keith has alluded to, those who have not done well, regardless of whatever age it may be, they always have a significant comorbidity. But I don't want to say that it was a shift in the disease dynamic. It's more a shift in the social population, how we've addressed and how our approaches to vaccination are at this point.
His second question, the number of incidental COVID admissions, an indicator of the level of community spread? Dr. Wu?
Yeah, absolutely. You know, so we've talked about going back in the hot tub time machine to the time before there was COVID-19, and there were always circulating coronaviruses. We never tested for them because they caused the common cold. But if you tested every single person for every respiratory illness that came into the hospital prior to COVID-19, we would unearth a lot of these diseases. So the number of incidental COVID admissions is an indicator at the level of community spread. Absolutely. We see that our percent positivity is going down, but we should expect to see that we will see more and more of these that are incidentally positive.
Thank you, Dr. Wu. Mike Savino from WFSB Channel 3. I've heard some ER nurses describing having to treat patients in hallways, at nurses' stations, anywhere they can find space to do so. They also say this is contributing to stress and confrontational patients. Can you talk about what's being done to address space and capacity, specifically in the ERs? Dr. Kumar, do you want to start?
Yeah, I'll take that actually. So Mike, thanks for asking the question. I do, you know, we're very grateful for all the nurses and doctors who are on the front line managing these really difficult times right now. And we've had occasional circumstances. I would imagine pretty much our entire country right now is facing that increase in the ED volume or ER volume and having to find different ways to manage the capacity constraints at the moment. I think what's really important to highlight that the healthcare system like ours and many others are stepping up to meet the need for the community. And healthcare heroes are actually working hard to make sure we provide care to everybody. Now we have in Hartford HealthCare, with fortunate to have 7 hospitals, have a large capacity to expand and contract as needed. So we are able to create those spaces for patients to accommodate. But there have been some circumstances where we are having to react to a large number of patients coming to the emergency room for a variety of reasons. And for a period of time, those means are being utilized to make sure that we provide care to the patients. And regarding the stress, it does cause stress among our colleagues, but we're so proud of a culture we have in Hartford HealthCare, leaning on each other, supporting each other. We're managing this as well as we can or anybody else can do at the moment.
Thank you, Dr. Kumar. Our next question comes from Ed Stannard from the New Haven Register. Hi, Ed. Thanks for joining us today. Why do you think parents are reluctant to have 5 to 11-year-olds vaccinated, and what are you doing to promote them?
I'll take that. Ed, it's really difficult as a clinicians to be able to speak on behalf of parents' mindset, quite frankly. And I don't know what else I can comment on regarding the 5 to 11 vaccination. It's best that our pediatric colleagues can comment on that. Would be the most helpful at this time.
Our next question from Tracy Keith, looking for clarification. Do you mean that these hospitalized folks in the ICU have other diseases and that COVID pushes them over the edge?
No, that's not a good generalization, but there's a number of people that are within the healthcare systems, not just in Connecticut, and definitely not just in HHC, that are diagnosed for COVID-19, as you know, Dr. Kumar and Ulysses stated, incidentally. So we are surveying everyone that comes in the hospital and that needs to be admitted. So not everyone that's in critical care that is COVID-19 that is there because of COVID-19. Not everyone that has died from COVID-19 is because of COVID-19. There's a number of individuals that are involved in that have high advanced age, for example, with other comorbidities. And that's how we have to be very careful in how we talk about or appreciate this data.
Back to the topic of incivility from Tracy. Have any staff at your hospitals had to call the police when incidents get out of hand?
Tracy, we have not required those means. I like to highlight that Hartford HealthCare has allowed visitation to occur, the families to visit and meet the patients in different healthcare settings. And we do believe the family's inclusion in the healthcare process, as much as we can allow safely at this time, helps manage the stress as well. So we've been fortunate to have really good collaboration. There have been incidences when the grievance is high, and I would say incivility directly, grievance numbers are high, that at times we need not be able to meet the expectations of the family of the patients or vice versa. And we've had some conversations around that. We all have to understand this is a stressful time for our society. This is a stressful time for our community. And healthcare systems are there to assist. And the more openness, the compassion we have for each other, the better the outcome is going to be. And that's our focus at the moment.
Her also question follow-up, have you had to increase security?
No, we have not had to increase security.
And masks from Tracy. Despite encouragement from public officials, we see many in public places without masks. And then she cites an example at the gym. 3 out of 15 people were wearing masks. Are those who are wearing masks protected from others? And what about those? What is their risk and why do you imagine they are taking it? Keith or Dr. Wu?
Yeah.
Can I just make one comment? Tracy, please don't ask a question why people behave the way they behave. We really can't comment on that. All we can comment on the science. So Keith will talk about science.
Yeah. So thank you, Dr. Kumar. Yeah, so we continue to support the fact that, and this is based on science, that having a mask is one of the #1 ways to protect yourself from COVID-19, not just COVID-19, but from other respiratory diseases. And this is what evidence shows. If you look at our flu data last year, and we continue to see that level of decrease in our flu data we have last year, this year's data, and we compare it to the years before COVID-19, where using a mask wasn't a social thing, right? We have significant decreases in our flu cases. So COVID-19, the impact that it has on COVID-19, we've seen areas within not just this community, but within our national community. We've seen areas globally that have worked on different messaging around masking and the impact that it has had on the spread of COVID-19. One thing that I will say, and we continue to say, is be very mindful of your personal risk assessment. If I'm going to the gym, not like I'm doing that at this point in time, but if I am, I would be wearing a mask. And I would encourage anyone that's indoor doing an activity that will increase your respiratory and your breathing, then certainly I think it would be a good idea to wear a mask, and the science would certainly support that.
And I don't see any other questions in the chat, so we will conclude with final thoughts. Dr. Wu, do you want to begin?
Yeah, I mean, I wanted to just really comment on the roller coaster that we're on, and we seem to be heading hopefully down. The tri-humped curve that we talked about in the past with Omicron, possibly causing another hump, and then influenza causing another hump. Looks like influenza numbers are also decreasing as well, but there still could be a surge. The way that I would look at it right now is if we are past our peak, it would be a prolonged tail, like a sawtooth tail. So we'll have some ups and downs over the next month or two, but would maintain a continual downward trend at this point. So I think that's where we're going to be headed.
Sounds good. We do have one question that came into our chat while you were speaking, Dr. Wu, from Ed at the New Haven Register. How do you convince people who have resisted vaccination after all of this time?
Let me take a shot at that, and then Keith will follow probably. Our role is to educate people, provide information, make sure we clear the misinformation they have received. And folks will make their own personal decisions about what they want to do at this time. We see as a healthcare system, as clinical leaders in this place, to provide information and provide access and provide ease of vaccination at the moment. And that's what Hartford HealthCare has been doing from the beginning. We want to meet where the people are. We not want to judge where they come from, where their perceptions, and address any misconceptions they have at this time. And hopefully folks will make the right decisions for themselves. Looking at the number of mortality, the conversations we've had about the ICU, the suffering we have seen among the people, I hope this does provide some pause for individuals who are still on the sideline thinking about the vaccination. Keith, anything else to add?
Yeah, Keith, anything to add? And then your final thoughts.
Yeah, absolutely. I mean, we have to continue to believe that there's hope to get more people vaccinated. I think that's very important. We have to continue to believe that the message, the message is going through, and we have to continue to rely on each other to communicate the right message. I think one of the big problems with this is misinformation. We've committed, not just Hartford HealthCare, but health systems within Connecticut have committed to spreading the right information. So we have to continue to believe that the opportunity, people will look at this opportunity. One of the things that we have to deal with is communicating to family members at the worst time. And the questions is always, if they were vaccinated, would it have made a difference? And if we look at the data clearly, you really don't want to, you want to be appropriate with your response. But if you do look at the data, it is clear that vaccinations definitely help to save lives. And this is very important. But again, we have to be very sensitive. There's people who are making decisions for many reasons, and we have to be sensitive on that. For final thoughts, I do think, in 1963, there was a significant reason for the speech, still one of the most touching, profound, impactful speech of all time, and it is the "I Have a Dream" speech. And it speaks of the future. It speaks of equity. And as an institution, as a community, coming out of the pandemic, appreciating the surges and so forth, we've seen impact of this on very disproportionate impact. But we've seen this before, where there's disproportionate impact on a number of things. And we have to keep through to our commitments to the community to maintain equity and create a better future for not just, the individuals who are living in that space of having a great insight in the future, but for everyone. So we'll continue as a system at Hartford HealthCare, not just with the message, but with our actions, and we'll continue to fight this pandemic and all the other pandemics that the community is dealing with.
Thank you, Keith. Nice segue into Sarah Lewis. Final thoughts regarding health equity and Martin Luther King Day on Monday and the observance that Hartford HealthCare will be doing.
Yes, a great segue. Thank you, Keith. I want to say, Tina and others, that I'm hopeful. Progress takes time, and it never stops. In order to get to a place of equity, we have to build processes that are equitable, and every little moment does matter. So we've talked today about how we have transformed the way we think about access to healthcare. We've talked about the way that we transform the way we think about healthcare through the lens of equity, and it has made a difference. And our colleagues give of themselves. They listen. The whole sort of premise behind neighborhood health is saying we're going to listen and we're going to engage, and we're not just going to do that on our terms. We're going to meet you where you are, and we advocate on behalf of our patients, on behalf of our communities, on behalf of families every single day. And this is meaningful. And so I'm so thrilled that another thing that we have to celebrate is that we're observing Martin Luther King's birthday on Monday. And he is someone who was keenly aware of injustice in this country, particularly as it pertained to healthcare. The quote that is attributed to him, that of all the forms of inequality, injustice in health is the most inhuman. It was because he was giving a speech to the Medical Committee for Human Rights, and he was speaking to the fact that despite the fact that it wasn't legal at the time, hospitals then were segregating patients and giving Black patients substandard care. So it's that action of witnessing, naming, and then taking aim at injustices as we see them that makes progress over time. And we're building on that legacy. And I'm so proud of the ways that we've been able to do that and model that throughout our system.
So much work has been done. Sarah, again, thank you for joining us, and to you and your team for all the work you've done so far. Still more work needs to be done, and you're at the forefront of that, and an important day of observance on Monday for Martin Luther King Day. So Thank you, Sarah. Dr. Kumar, your final thoughts.
Thank you, Tina. So, I will stay on the same topic here. It's really important for media and other members who are listening right now to really show commitment towards improving access, improving equity in this pandemic. And I'm hoping you're going to write something about where such a landmark day is coming up on Monday, that we emphasize the impact a pandemic has on those populations which are underserved, which have been segregated, have been undermined for some time. And I think, how do we actually improve that process and access at this time? Now, from the beginning, we have been fortunate. I have been fortunate, having grown up in a different country and living here, having to learn from Sarah and Keith and many others about how we need to position the pandemic response. And what Hartford HealthCare has done from the beginning, under the guidance of individuals like Sarah and Keith and many others, is to provide access to the communities which have no access, getting to the places where getting to them is difficult. And we've learned about ourselves as well as the healthcare institution, that how do we position ourselves. So we have a lot of work to do, but some of the work in testing, in homebound patient care, and places where Keith and other members have shown up to provide the vaccination boosters and access to testing, education, access to information through our work we've done in the in different forums, the digital and other means. All those actions contribute to improving the community's well-being. And we hope to continue to stay on that path for a long time, as long as possible, as hard as we can do it at this time. So I hope today, although we're talking about number of COVIDs and Hartford HealthCare and other challenges, but one of the focal points should be that how do we actually address the healthcare for all, not just for few? And that, I hope, is the message for today's conversation.
Thank you, Dr. Kumar. Thank you to Keith and Dr. Wu and our special guest, Sarah Lewis, for joining us today. And thank you for all of your questions. That concludes this media briefing. We will not hold a media briefing on Monday in observance of Martin Luther King Day, but we will be back here on Tuesday, and we hope to see you all then. But for now, have a wonderful weekend and be safe. Thank you.